Welcome to the Leeds Integrated Heart Failure Clinic at Leeds General Infirmary, part of Leeds Teaching Hospitals NHS Trust. The clinic can be very busy, so the aim of this short video is to tell you a little bit about us and what we do. At the first visit, we will establish whether you have a problem with your heart and what treatment is best for you. So the first appointment may be a little longer than any follow-up appointments and could take several hours. But many people, once we've seen them and assessed them, only need to come once.
Perfect.
After you've checked in at reception, we will usually perform an ECG. This is a simple electrical tracing of the heart that looks at the rhythm and coordination of the heart and gives us an idea of whether there has been any damage. If this is your first visit, we will usually also organise an echocardiogram. This is an ultrasound scanned image of the heart which allows us to look at the pumping function and the valves. Our specialist nurses will usually check your blood pressure, height and weight, and after this you will see the doctor, who will discuss with you, based on the tests that you've had done, what treatment is needed and how this will be started. Usually, the tablet doses will need to be increased in stages. Many patients can have this done by their general practitioner or the specialist nurses based in the community. Our community nurse team will often be able to come and visit you at your home, or they may ask you to come to a clinic closer to your home. We will often arrange a follow-up appointment at around 3 months here at Leeds General Infirmary to check that everything is going smoothly. In the meantime, we may organise other tests to provide us with more information about your heart. Further testing might include an exercise test on a cycle or a treadmill. Many people are apprehensive about doing an exercise test, but the test will be adapted for you and your exercise capacity. It's an important and safe way to collect lots of information about your heart rhythm, the blood supply to the heart, and how the heart responds to activity. You will be asked to wear comfortable clothes to the appointment, and the technical staff will then connect up an ECG and ask you to breathe through a mouthpiece to collect samples of the air you breathe in and out during the test. You will be asked and encouraged to exercise until you are too tired to continue, but you will be in control of how much you do and you will be able to stop at any time. The results of the test will be sent through to the doctors, who will discuss the results with you at the consultation. One of the other tests that we do is a special scan of the heart called an MRI scan. This is a very accurate way to look at the heart and its function and can also show us clearly whether there are any problems with the blood supply. Some people with certain pacemakers and other metal implants are not able to have an MRI scan. On the day of the scan, you will be asked to come to the MRI unit. A nurse will talk you through the way the scan is done, and you will then be asked to lie on a narrow table and they will attach a special ECG to you. You will also be given headphones so that you can communicate with the technicians throughout the scan. The table will move into the scanner, and at intervals the technical team will ask you to breathe gently or hold your breath as the pictures of the heart are taken. The scan lasts about 30 minutes. The results are usually not immediately available, but a result will be forwarded to the doctor you saw in clinic, and you will be able to discuss the results at your next appointment. It is possible that your treatment will include a special pacemaker to improve the heart function and also to give protection against irregular rhythms. If your doctor decides that a pacemaker is the best way to treat your heart condition, he or she will discuss this with you at the consultation. They will tell you about the procedure and offer you a date that suits you. Most pacemakers can be implanted under local anaesthetic, and you may not even need to stay in overnight. On the day of the procedure, you'll be asked to come to Ward 14, which is in the Leeds General Infirmary on the same floor as the clinic. The nurses will check you in and show you to your bed. We may ask you to bring overnight things, even if the plan is to let you go home on the same day. Before the pacemaker implantation procedure, you will meet the doctor doing the operation again, who will describe the procedure to you and ask you to sign a consent form. After this, you will have a drip put into a vein in the arm, and a dose of antibiotics will be given by the nurses just before the operation. For the pacemaker procedure, you'll be asked to lie on a narrow table. We will make you as comfortable as possible. You will usually be awake during the procedure, which is done under local anesthetic, but you can request sedation and additional pain relief if you need it. A pacemaker implant procedure takes between 30 and 90 minutes. The pacemaker is inserted through a cut in the skin under the collarbone. Beneath this is a large vein that runs from the arm into the heart. This allows us to pass the leads through into the heart. Different pacemakers need up to 3 leads placed into various positions in the heart. Each lead is attached to the chest muscle under the skin and is then connected to the generator, which contains a microcomputer and a battery. This is then placed under the skin, and the skin is closed using absorbable stitches. A dressing is then placed on top of that. When you return to the ward, you will usually be able to sit up immediately, and the nurse will offer you a cup of tea or coffee and a sandwich. The doctor may organise a chest X-ray to look at the pacemaker and the position of the leads. Before you go home, the pacemaker will be checked by a technician to make sure that everything is functioning as it should. In around 2 in 100 patients, one of the leads doesn't function optimally, and although this can often be rectified by adjusting the programming of the pacemaker, sometimes this is not possible and a second operation is necessary. If this is the case, this will usually occur at around 6 weeks after the first. The wound will then be dressed by the nurse if necessary, and you will be given the telephone number of the ward so that you can get in touch if there are any questions or problems after you go home. Although the main aim of the Heart Failure Clinic is to provide you with the best currently available treatment, the Yorkshire Heart Centre is one of the largest cardiology research units in the country. We want to find out how to improve things further for our patients, and it is our aim that all patients are offered the opportunity to participate in research during their visit. So you may be asked to participate in one of our research studies, and the doctor who sees you in clinic will usually ask you about this at the end of the consultation. Current studies include a trial examining the effects of vitamin D supplementation in people with heart failure, a study of a new type of heart failure pacemaker, and whether a slow heart rate influences exercise capacity. We are also looking at how to individualize pacemaker programming. Current studies are funded by the Medical Research Council, the National Institute for Health Research, and the British Heart Foundation, and all research studies are approved by the Research Ethics Committee and the Research and Development Team at Leeds Teaching Hospitals NHS Trust. Getting involved in research is not expected, but many patients enjoy being involved, and some then go on to help us design future studies and help with the running of ongoing studies. Our aim is to treat future patients better. We want to provide you with a high quality and timely service, but if you feel that any aspect of your visit has been unsatisfactory, you should mention this to the doctor or the clinic staff.